Hello, hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Nadira binti Abdullah and I'm from PEC 301, which is the ethics, and I'm currently taking Bachelor of Pharmacy, and this is my video on reflection on what I learned in my PEC. So the first, I would like to describe what the weekly activity that we have done. So the first, we got 6 weeks. The first following week, we was distributed into groups and we were giving information about what to do, and we get to know our group mates. And the next following week, we have a role playing that needed us to role play on the ethics of healthcare. My group was given a scenario and we needed to do a role play about the scenario. Okay, the second week is that our group, every group was given a strip and we needed to guess the word based on the strip, and we also needed to guess what is the word without saying the word. So it requires a lot of knowledge about other profession. And the next week is debate weeks, and my group got the defender about the debating topic, and our group my group wins the argument. And then for the week 3, we were divided, one group was divided into two, thus there's 6 group in total. And then from the last week, which is my group, a weekly activity, we done the activity which need us to give out information about a specific word. You need to describe the word without stating the word. You need to describe it like using your body language or describing it like, but we cannot say the word, and pass it to the last person, and the last person would guess what is the word given to the first person. Okay, so the objective of every game given by every group is to teach us about the ethics in healthcare system. So I think that this objective was reached because I myself learned about the ethics of healthcare that I didn't know before, such as during the debating, I just know that healthcare professions cannot give out medical issue. I just know about that. And I also learned that the ethics that we need to ask the patient for concern about the surgery before, because I don't work as a surgeon. I don't learn about what MBBS learned. So I learned that MBBS student in the future need to ask the patients about their consent before the surgery is proceed. Okay, so the next thing is that does all this activity is important to teach ethics? I think yes, because it really opens up my mind and my knowledge about other professions and the ethics. I think that ethics is very important, and I think this weekly activity can teach us a lot about ethics, since role playing also portray a very clear way of ethics in healthcare system, and I learned it that way. And I also learned a lot of words from other professions such as doctors, nurses, microbiologists. So one thing that I learned from ethics and professionalism's activity is that we as a healthcare, we need to have the right ethics in while doing our profession. It doesn't matter the ethics between a healthcare profession such as me as a pharmacist to a doctor. It also requires ethic from us to a patient. And I also learned that different ethics depends on different situation, such as when we were debating, I learned that the ethics of stating someone's healthcare issues, usually in normal circumstances it cannot be stated, but if the man or the woman, the patient, is not on the right side of mind, then the healthcare can say medical issue in order to protect our patients. Okay, that's what I learned during this ethics activity. Contribution in this activity is that I participate in the group discussion, and I also participate in the games, and I'm an active kind of an active student during the game. No, I'm not very active, but in the situation, if they ask me to speak my mind, I would, but I'm a bit shy. For our weekly activity, I really participated in the discussion since during the activity I was unwell and I received an MC from the doctor. So I think that my contribution, to be honest, I don't think it's enough. But I learned so much that I'm happy, and I'm very happy that I have a very supportive group mates, and they were also concerned about me. So I didn't think my contribution is enough, but I'm very proud to have such a group mate that they very much look after me when I stated that I was in a unwell state. In the future, I hope that I can use the skill that I learned, which is ethics and professionalism, during my internship or during my work, when I participate in the distribution of medicine, or when I needed to see the prescription. I would be honest and I would do my job professionally, and I would ensure that the prescription given and the prescription written and the medication that I dispense is the right one, so that there won't be any health issues or other dangerous situation in the future. Because I think that in the healthcare system, the first catch you will be tested is that the health is going to relate to your life and death situation. So it's very important for ethics and professionalism to have in every healthcare profession. That's all from me. Thank you. Bye.